Hey, welcome back to my channel. Today I'm not going to be doing a True Crimes Tuesdays because I haven't really had time to do the research to make the video. I've just been so busy with work and trying to make the most of this heat because we are having a huge heat wave here in England at the minute. So I wanted to be outside, and work was busy last week. I just haven't had time to do the research. I know which story I'm doing, so I am working on it, but I want the video to be good. So I'm not doing True Crimes Tuesdays this week, but there will definitely be a video on it next week. So for today instead, you've got patients everybody hates. So this is going to be about the patients that we as dental nurses, and I'm sure doctors and everybody that works in the medical field, hate. So if you want to learn about the types of people that we really don't like and make sure you're not one of them, then just keep watching. Okay, so the first thing which patients do that is so annoying is when they cannot spit into the spittoon properly, and they literally projectile it all over the floor. The sink is right there. You just need to put your head over it and spit in it. Don't try and go and aim for the bowl. Put it in the bowl, because the mess that we get left with to clear up is gross. You've got your spit and the rest of the mouthwash over the floor. Sometimes it gets all over the chair. It goes all down the spittoon, and it's just like, oh, for God's sake. I'm just going to show you an example now of what they do. Okay, so that kind of coincides with my second most annoying thing that patients do, and it's when, okay, so in the drill you've got water. It's just water. And in your mouth, obviously, there's saliva. So the nurse will be obviously suctioning, the dentist will be with the drill, and the patient's making saliva constantly. So we're sucking up as much as they can, and every few seconds they're like, I need to spit. Love, it's your own saliva. If you feel like you're choking, then okay, you can spit. But when you're like, I've got something in my mouth, yet it's water and your own spit, you can swallow it. It's your own saliva. We won't even use the water, and they're like, I need to spit. It's your own spit though, so just swallow it. I wouldn't mind so much if you could clearly see the patient was struggling, but most of the time it's just a waste of time. And that every time you keep stopping when you're having something done, it just makes more work for the dentist, and it takes up way more time. So just, if you can swallow it, swallow it. If you can't, fair enough, but it's just your own spit. Okay, number 3, and this one is really irritating, mainly for the desk, the people on the desk, but also for the dentist and the nurse as well. And it's when a patient misses an appointment and you phone to say, oh, you've missed your appointment, do you want us to rebook it? And they tell you they haven't booked that appointment, we must have done it. We have better things to do than just to say, oh, I'm going to book Mrs. Smith an appointment today just for a laugh. Why would we do that? You must have booked the appointment. Normally, it's when they last came in 6 months ago and they forgot they booked it. But don't blame us and say that we did it, because we just don't do that. Okay, I think I'm on to number 4 now. So this one, again, this is directed more towards the reception, not necessarily the nurse or the dentist, but it is annoying because they still come into the surgery and complain about it. So it's when they complain about filling out forms and the price of the treatment. These forms, they're legal requirements. We have to update your medical history every year. We have to do that. It's a legal requirement. We don't make up charges for the NHS. They are the NHS charges. Band 1, Band 2, Band 3. We don't make them up. The NHS do. Complain to them, not us. But the forms, we have to do them. We need your consent to be able to leave messages. It's like doctors. They won't give any information to other people except yourselves. We're the same because we handle sensitive information. So just fill out the form. You can question us about it, about certain questions, but just fill it out. Don't complain that you've got to do it because you have to do it. It's legal. If you just want to have a rant about filling it out, just don't even bother wasting your breath, because there's nothing you can do about it and there's nothing we can do about it. Okay, so I think I'm on to number 5 now. Number 5 or number 6? Number 5, I think. So this one is when patients phone up for an emergency appointment and they haven't been for years. And the reason this is annoying is because you are supposed to come at least once every 2 years, at the very least. Shock horror, dentists can prevent problems happening because they see it before it becomes a problem. So if you haven't been for like 5 or 6 years and you get a toothache, the chances are the dentist could have probably solved that before you got a toothache. It doesn't mean you're never going to get a toothache or you're never going to have a filling, but they're more likely to spot it before it actually becomes a problem. And normally when they haven't been in for so long and they ring up for an emergency, they ring up at like 12 when you're supposed to ring first thing in the morning, because by 12 emergencies have gone. And what we then have to do is double book. We just have to slot patients in between, well, on top of another patient's appointment. So like 2 people can have an appointment at the same time. That makes the dentist run late. Don't expect to be seen on the day straight away if you haven't been for years and you're ringing up for an emergency, because you haven't been for years and we might not be able to fit you in right then. Okay, so this brings me to number 6, which I think is my last point for this video at least. I've got so many more that I can tell, and I'm probably going to do a part 2. But for this video, this is my last point, and it's when somebody comes in for a checkup and the dentist always says like, oh, is there any problems? And occasionally you get, yes, I broke my tooth the other day, but more often than not, you'll get, yeah, I broke my tooth. Oh, when did that happen? Oh, 6 months ago. Why did you not come in 6 months ago? And like, okay, fair enough if it was 6 months ago and you just thought you wait till a checkup, but it's the patients that say, can you do it today? No. You've got a 10-minute slot booked for a checkup. You don't have a half an hour slot booked for a filling. We can't do a filling in 10 minutes unless we want to overrun and then run late for the rest of the morning or the rest of the afternoon. If you've got something wrong and you wait till your checkup to tell the dentist, don't expect him to do it there and then, because they can't. They don't have time. And this just grinds on me because so many people just expect it to be done then. They just want it done right now. They thought, oh, I'll just wait until I go see my dentist. Okay, fair enough, but don't expect to have it done then because there isn't the time. Like, people think that you have like 1 patient, then a break, and then like 2 patients, then another break. No. You are solid working out through your whole morning, then you have emergency space, and then you have your afternoon. Like, there isn't any more space. You don't have like 5 breaks in a day. You get 1 break, which is your lunch break, and then you have emergency space. And obviously, if that doesn't get filled, it's a little bit more of an extra break, but generally it does get filled. We don't have loads of breaks. We are one after the other. It's back to back. Anyway, that pretty much brings me to the end of this video. So I hope you guys enjoyed. Sorry, it's a bit ranty, but I need to get it out. Be the patient that comes in every 6 months for a checkup and it's just nice and not late and makes your day better. Anyway, I hope you guys enjoyed this video. If you did, don't forget to give it a thumbs up. Click that subscribe button down below and I'll see you in my next video. Bye!